Good morning, everyone. Rise and shine. I hope everyone has had a great week. I'm Ellen Tibbetts-Hurst, and thank you for joining me on this early morning, July 18th, 2025. And I know it's been a hot week. It has been, but you are watching Rise and Shine with the Alabama Cares program, and we have a great show for you this morning. You know, I always try to bring you new education and new resources for your communities. And, well, we have the president of Regional Medical Center with us, Keith Parrott. And welcome, Keith, and thank you so much for joining us. And I know that many in our community have been wanting a positive change when it comes to their hospital. And so I think this is going to be a very well-received show because I think everybody wants to hear from the new president because you're the new guy in town, right? Kind of, so to speak. So let's start with your background a little bit. I want to start with that, your background and how you got to RMC.
Sure, absolutely. So thank you for having me. It's a pleasure to be here and sharing Friday morning with everyone and talking about a subject that's near and dear to my heart, which is RMC health system. So I've been in healthcare management for over 30 years, most of that time in Texas, in Houston, Texas. Took a job with a hospital in Birmingham in 2008. Spent the next 12 years of my career there. Then had an opportunity to go to Chicago, so I spent the COVID years in Chicago, which that's a whole nother show. That was a very interesting time to be working in Chicago. Ended that job there, came back to Birmingham, was doing a little consulting when the board of RMC reached out to me to know if I would want to know if I consider an interim assignment coming in to kind of help them with some transitions with Louis Bass, the CEO, retiring, and so. I was enjoying the time out of the stress of hospitals, but was also missing it. And so my career has really been turnarounds, not planned, just kind of that's how my career has unfolded. I've had these opportunities after opportunity to go into hospitals that may have been struggling and not doing as well as they need to. And, you know, it's tough work. You know, the majority of those times it's been successful. We've turned things around. There are times where we haven't been successful. And so I've had the fortunate experience to kind of learn and understand, you know, what hospitals have potential and what hospitals don't. You know, what situations just need some, you know, attention on different areas to turn things around. And so, you know, after spending a little time here, I realized this hospital has more potential for positive outcomes and for doing well than any of the turnarounds I've been involved with. So, well,
that's good to hear.
So I'm here full time now and very excited about some of the things and opportunities we have to really make sure RMC is becoming the hospital and is a hospital that this community needs. Right,
and I know that, you know, because RMC has had some issues, and I know reputation-wise too, you know, they've had some issues because, I mean, I work with the Alabama Caregivers program in 10 counties, so I hear a lot of things too, you know, and, you know, as part, you know, I'm a native here in Calhoun County, and you want our local things to do well. And so when you came to the Exchange Club, which I am a member of, you were talking and you just intrigued me, you know, just perked my ears up a little bit, wanting to know more. So I thought it would be great for you to come here and to tell everyone, because I think everyone needs to know, because they don't get to hear from the president of the hospital. You know, I mean, unless they go and make an appointment with you, right? So I think that's why it's so great. And I know you said that you saw incredible potential here at RMC, and that and the clinical capabilities, you were talking about that, I talked to at the Exchange Club as well. So, so what you spent your time listening and assessing. Can you elaborate on that a little bit?
Yeah, so anytime I come to a new situation, you know, I have thoughts and ideas based on my past experience about, you know, what might work and what might not work. But one thing I've learned is if you've seen one hospital, you've seen one hospital. I mean, you know, the situations and the environment, you know, varies from situation to situation. And this was unique for me. Most of my career was in Houston, Texas, in Chicago, Birmingham. And so understanding that in a smaller market, you know, there's some nuances there that I need to understand. So spent a lot of time meeting with mayors, with elected officials, with lots of physicians. Probably had 30 one-on-one meetings with physicians. I called some former employees who used to work at RMC and that had left, just to try to understand, some of their experiences.
What's the good, bad, and ugly, right?
Yeah, and review a lot of data,
right.
and so really trying to understand what does the data say about, the opportunity here. And so one of the things that kept coming up was really an opportunity to improve trust. I think if you look at the thing that's consistent, everyone that is frustrated absolutely wants a great hospital and great care in this region. And so, even though, and I think there was a lot of maybe misunderstanding, maybe people didn't understand everything that was going on. And so the approach that we want to bring now is to really bring transparency and trust. And I think no hospital is perfect, and so I've never been in a hospital that was 100% on everything.
Right.
You want to get as close to 100% as you can. We probably have a little bit more progress to make than some other hospitals, but we're going to get there. And so one of the things that was really important to me was the strength of the medical staff. And so a hospital is only as good as the physicians. That's
Well, that's a given, yeah.
Well, and so you come to RMC, and most hospitals, especially outside of an urban area in the state of Alabama, they're closing their OB programs. And so I come to Anniston not sure what I'm going to find, and we have, I think, 9 active obstetrician gynecologists. I mean, that's more than some of the hospitals in metropolitan Birmingham.
Wow.
And I went to their first department meeting that lasted 2 hours. Normally a medical staff meeting that goes 2 hours, there's a lot of complaints and frustration with administration. It was almost all about quality and how good their quality is. Frankly, great. Our obstetrics department has a Blue Cross Plus distinction. So Blue Cross recognizes hospitals for excellence in specific service lines. We have the highest Blue Cross certification you can have for quality in obstetrics. And I saw why. When you have physician leaders who are pushing each other and trying to figure out, okay, our rates are some of the best in the state, but how do we get better? For instance, C-section rates. Cesarean sections are a normal thing, but it's not ideal. You want to avoid that if you can.
Last resort.
Exactly. And so we have really good C-section rates, and that's a result of the physicians really cooperating with the nurses and staff to work on that. So I was like, man, what a lot of hospitals in the state would give to have half of these doctors and to have not just the quantity but the quality. That was very encouraging for me.
Right.
And so I could go through lots of different service lines, but that's one example of things that I saw. Okay, the core building blocks here to be successful are here. We just need to really get a plan together and start moving things across the whole hospital in the right direction.
Right, move it from OB/GYN to emergency room to all the areas.
And that's very busy cardiology program, great cardiology services, orthopedics, urology. Again, you go through the specialties. Unless you need open heart surgery or neurosurgery, we can do 90-95% here. We just need people to trust us and come back that have been leaving the community to get that care. And you mentioned the ER. That's an area where we have lots of room for improvement, and happy to talk about that if you have questions about that. But
yes, we'll get to that too.
Yes.
We'll get to that
I'm
too.
sure. I know that's a hot topic.
So I know that you said that you had called past employees.
Mm-hmm.
So were you trying to figure out maybe, I guess, what is your plan on retaining those nurses and those physicians that are already here?
Yeah.
Because, I'm here to ask the hard questions.
Sure.
So,
yeah.
Because I know that
Mm-hmm.
I have heard of my husband's colon doctor, as a matter of fact, left RMC. He went to another hospital, and so just with little things like that, this is before you came along, So I mean, what are your plans on trying to retain, the retention of keeping those nurses and those doctors,
Yeah. So there's lots of things that go into that. One of the challenges we have from a retention standpoint is, we're competing against hospitals that are based in Georgia, hospitals based in Birmingham, and in some cases they have this is a complicated, they have better reimbursement rates and puts them in a position to maybe pay their staff a little bit better. We can't use that as an excuse, but we've got to do some things to improve our financial performance so we can pay better. We have raised, our rates for starting grads are pretty competitive. Where we run into issues is we have what's called compression, where a lot of our experienced staff, we haven't been able to give them the raises they need to give. And so we have a long-range plan. Well, I say long-range plan. It needs to be a short-term plan of lots of things we can do to improve our financial performance. And my message to employees in town halls and my weekly email updates is, the reason we're trying to manage our supply expense and manage overtime and do things to improve our financial performance is so we can pay you more money. Because that's, when you look at lots of research, money's important, but a lot of it also is the culture. And so every hospital in the country is required to do a culture of safety survey where they interview their employees. And I want to go into specifics, but our baseline survey shows we have a lot of work to do there. Our employees are basically telling us that they don't feel as supported as they need to be to do the work they want to do. So that's on me and our leadership team to really change that culture. So it's a combination of make sure we have competitive pay, but it's also, how do we engage people and really help our employees feel like they're supported, they know us, and we're going to support them to doing the right thing. We just recently had someone we brought back as in a director role at our hospital. That individual left to go to a competing hospital, spent some time there. We were able to recruit them back. And so I think some of the enthusiasm and the new things we have going on are going to help us attract people back. And so culture's one, and we got to get our pay rates up where people feel like they're being paid
and that's
fairly.
with any place, right?
Absolutely.
So and we'll hold that thought. We're gonna talk a little bit about that, and I also want to talk about how a lot of people they view RMC, because RMC is not really a for-profit. Am I saying that right?
That's true. We are a not-for-profit. We're actually a healthcare authority hospital.
Right. And we'll I want to elaborate a little bit on that, because I think it's important for the public to understand that. So we are going to take a short break for a word from our sponsors. You are watching WEAC TV 24's Rise and Shine with the Alabama Cares program, and we will be right back.
I want to live. The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I Want to Live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
I'm Alan Parnell, Parnell Insurance Agency. We've been here in Oxford and Alabama, Tallapoosa, Georgia since 1990. With Auto Owners Insurance, we're able to give customers competitive pricing along with excellent coverages. Parnell Insurance can handle all of your personal, commercial, and life insurance needs. We have a very experienced staff, both personal and commercial. All together, we've got about 125 years experience. Come see what our insurance agency can do for you in Oxford, Alabama, and Tallapoosa, Georgia.
Auto Owners Insurance.
Hey guys, this is Blair Smith at Pediatrics Plus here in Anniston, located on Henry Road. I'm over here on the well side, but we do also have a sick side urgent care if you need us. We are more than happy to see you guys. Just come on, check us out if you get a fever, cough, or cold, or want to come in for a good checkup. Thank you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201-1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
Welcome back, everyone, to Rise and Shine right here on this beautiful Friday morning. And we're here with Keith Parrott, our president of RMC. And so we have so much to talk about. And I think this is such a great opportunity, like I said at the break, because the public just, we don't get the whole story sometimes. You know, you only get that one. I always say it's kind of like leaving a Google, you know, what do you call
Review?
it? Review, yeah. It's almost, because you may have 1,500 people that did the same thing, but then you have the 10 that were really mad about it, and that's the ones that you see. You know, because the other 1,400 didn't, they did not leave a review, right? I mean, I always say that because, you know, really how good are the reviews? You know, I always say that because I know that when sometimes, you know, that's why I'm a true believer in always patting somebody on the back or always, you know, giving a compliment, because too many times we always say the bad things and not enough of the good things. Right. And so I'm really glad that you came today to talk about all this. And we were talking about some of the things that some of the public, that they don't realize, that number one is that RMC is not a for-profit hospital. And I think a lot of people get that so confused. They're like, oh, well, all they care about is the money, or all they this, or all, you know, and I'm like, well, you know, because the for-profit versus what RMC is two different things, right? Right. So I've worked for both. I've worked for publicly traded companies that, you know, they have stockholders, and I'll never forget that one company I worked for, the CEO of the company came to talk to our nurse, you know, clinical managers, directors one time, and it is a little bit different. Both not-for-profits and for-profits care about their financial performance because they need to reinvest in the company. Right. Any for-profit business, you know, well, so anyway, the CEO would come and he would say, look, I want to be really clear. We're a publicly traded company. We exist to provide a return to our shareholders. Now, the way we do that is to deliver great health care. And so I appreciate his integrity, because he was saying, he was not denying the fact that we're here to make profit, but we can't make a profit if we don't deliver great care. Right. So you take a not-for-profit like RMC, we don't care about having a 10 or 20% EBITDA margin. You know, we're not focused on how do we generate enough return for people to buy our stock. It's how do we make enough money to pay our staff, to reinvest in the hospital, to give them, right. It's, we have an obligation to be good stewards of our resources, not so we can make a bunch of money for stockholders, but so that we can reinvest in the community. And so there's some things I want to talk about that with our vision statement. I don't know if now's a good time to talk about that. Sure. But, well, so I'm on your time. Yeah. So you know, one of the things the hospital really needed was a clear, concise vision. You know, why are we here? We're not here to make money for somebody. We're here to serve the community. And so we spent some time with the board and senior management team and really came up with a vision statement where we tried to say as much as possible with as few words. And so our vision is to be the trusted source for health and wellness in our region. Yeah, there you go. And so while it's not a lot of words, there's a lot to unpack there. So, you know, trusted source, I mentioned before, I felt like there's lots of opportunities to build trust between the hospital and doctors and politicians in the community. And so we got to reinforce that over and over again. You know, when employees have a decision to make, you know, when they're dealing with a patient or a family member, we have to make the decision that's going to reinforce trust. If we can do things where people know that they can trust us with their health care, they're going to choose us. I mean, my vision is somebody gets sick, they say, take me to RMC because I know if they can provide the care, they will. If not, they will send me to wherever else I need to go. But I can trust them that they're going to do the right thing for me. We had the freedom to do that as a not-for-profit community-based asset. You know, the health and wellness piece, that kind of focuses on, you know, health is our core business. You're sick, you've got a hip that needs to be replaced, or a heart valve that needs to be opened. You know, providing that sick care is our core business. But as we do better at that, and we start to make more money, and we're reinvesting in our employees and our facilities, with what's left over, that should go in the community. So how do we invest in St. Michael's Clinic to help people who are under the poverty level get access to preventive care? How do we
go into the schools and educate on diet and exercise and wellness. There's a lot of work we can do.
Right.
So as we have excess profits, it's not going to be returned to a shareholder. It's how do we expand and do things not just to take care of people when they get sick, but to proactively help them not get sick and hopefully
Right.
not need to come to us, or at least delay it.
And
Yeah.
I'm a firm believer, like when people are talking about you and they're in the know.
Yeah.
You know what I mean? You have to be, because out of sight, out of mind kind of thing, you know?
Right, right.
And I think that's a wonderful way to do that, is to be proactive.
Yeah.
To be out there so that somebody can say, oh, well, I went to this event, or
Yeah.
I went to this and somebody spoke to us and they said RMC, or,
Right.
that kind of thing. Because I feel
Right.
like a lot of times, I've been doing what I've been doing almost, it'll be 25 years next year, and I know that just in the time that I've been in my job that, there hasn't been very much, I guess, talk between the hospital and, we cover 10 counties.
Yeah.
But like I said before, when you came here, I would love to have a better relationship with RMC, because you guys not only serve Calhoun County, you have the area too.
And that's why in that vision statement it says region.
Right.
So we're based in Anniston, but we need to be the trusted source and the first choice for people in this 5-county region. It's and so
Right.
we need people from Oxford, people from Jacksonville, people from Piedmont.
Right. And then
It's
you got
one of those
Cleveland
things
County,
exactly,
Clay County.
and it really burdens me that people who can get to RMC quicker are choosing to make a trip to a competing hospital. And
Right.
I understand things may have happened in the past that caused that, but the message I want to get at is that's going to change. We have an obligation as the healthcare authority of the city of Anniston that's serving this broader region to do everything we can so that people can make the convenient choice and not
Right.
the inconvenient choice to go someplace because they feel like they trust that place better.
Right, right.
And we're gonna
and I
fix
know
that.
that, I had a wonderful experience in the emergency room. Wonderful, and then part of it was.
I need you to fill out a survey.
I did not. But and it wasn't all great. I'm not saying
We still
that.
have
This
work
has
to do,
been
yeah.
a while. This wasn't during COVID.
Oh, okay.
And my husband's military, and he passed out in the field at Pelham Range, and the ambulance brought him to RMC. Dr. Crawford was there. If you're watching, thank you so much. I never got the opportunity to thank you like I should have, but that man was so incredibly nice. And not only was he nice, but he was very professional and very reassuring. I'd go in my husband's, in the emergency room where he was, and I'd suck it up, to be strong for him. And then I'd go out in the hall and just lose it. And every time I was in the hall, he was just very reassuring,
Right,
And
right.
long story short, my husband ended up having to have a pacemaker. So, but he sent my husband to his where his heart doctor was, and made sure that everything was in line to where he came there and said, he's serious, but I got him stable. He's all right. He just kept reassuring, and that was just so nice, and just so made you feel good. That was a very good experience. When a doctor, when a doctor hugs you and says, it's serious, but we got this.
Right.
It's okay.
Right.
As a family member, you need that.
Yeah.
It's a little bit above and beyond just the medical part.
Well, Dr. Crawford, he's one of the reasons I've decided to stay and work here. Again, clinically outstanding, but has that compassion piece as well. So I spent some time with Dr. Crawford in his office Friday afternoon just talking about ways we can work together. He's on our board. He's on the board of directors of, so he's my boss basically. But we've got that complement of physicians and staff. I'm glad you brought up the ER. That's an area where, to be transparent, we have lots of room for improvement. And so
wait times.
Yeah, and so one of the things I've learned over my 30 plus years in healthcare is there's kind of 3 components to drive a better patient experience and patient satisfaction. It gets down to processes, people, and place. And so, I'll start with place is the physical environment,
Right.
and Yeah, the hospital is kind of old and beat up. I've been in a lot worse. And so we need to spend some money to upgrade facilities. But that, I would say that's probably the least important of the three, and something we'll get to as we do better financially.
Right.
I would say, you know, moving from least important towards more important, the P of process is how do things happen, you know, are you valuing my time? You know, are the processes smooth? And so we looked at a couple things. One, the percentage of people that were leaving the ER without being seen was way too high. And the people who actually needed to be admitted to a bed, that wait time was way too long. And so we set very specific goals to dramatically reduce those. And I'm happy to tell you that after 3 or 4 months of focusing on that, we've cut those in half. So the people that left without being seen, that was running as high as 5%. We've got that down to around 2%, which is a little below the national average.
Right.
The time it takes from a patient to get admitted from the ER to a room has gone from 12 hours to 6 hours or less. And that's well better than national averages. So we don't want anybody to wait, but there's some realities about when beds can be available and things like that. So
and it takes time.
It does, but the most important thing, P, is people. And that gets in the culture thing. And so there's a lot of work we need to do. We, you know,
not just the numbers.
No, exactly. And so I've spent time in scrubs in the OR. I've spent time in the scrubs at our Stringfellow campus, which still does outpatient surgery, does gas endoscopy services, has an urgent care center. Spent time in the ER, and we got a lot of good people. You know, but there's always opportunities to improve and train, and
that's anything in life.
Yeah. And so we'll get there, but we're making good. I'm pleased with, in the 6 months I've been here, the receptivity I've had, whether it's the board, medical staff, management team. When I'm identifying things that need to be improved, I'm not getting pushback. People are saying, okay, how do we do that? So I think we're going to make some good progress over next year.
And I know that, you know, I've heard things, you know, just like I have contracts with home health agencies, and I know my home health agencies, ever since COVID, has had a hard time retaining their employees.
Oh, yeah.
You know, it's high turnover rate. Yeah, very high turnover rate, and it's sad, you know. And so, and I know that I have a sister-in-law that's a RN up in North Alabama, and she was telling me some of the things that she's experienced too. And she's a charge nurse with, I think, orthopedics or something in surgery. But she was telling me about just little things like, you know, the custodians and how hard it was to keep them and all that kind of stuff. And so, and we'll elaborate about all of this too.
Sure.
But we're going to unfortunately have to take another break for our sponsors. You're watching WEAC TV 24 Rise and Shine with Alabama Cares program. We'll be right back. Don't go anywhere.
The weather is warming up and spring is just around the corner at Miller Sand and Landscape Supply. I'm Craig Miller, and we've got something for everyone. From bulk materials like sand, gravel, and mulch to beautiful outdoor decor to make your outdoor living space the envy of the neighborhood. See our beautiful selection of Mazzarelli fountains, flowers to brighten your garden, and an outdoor center loaded with beautiful decor. Whether you need a little or a lot, visit Miller Sand and Landscape Supply.
Hey, this is Jason at Reeves Insurance. Just want to say a quick thank you to all of our customers for your support over the years. We now have offices in Anniston, Alexandria, and Oxford in order to serve you better. So stop in and see me or any of our experienced staff and let us shop for you. We'll find you the best price and the best coverage available. Thank you.
The Civilian Marksmanship Program, also known as CMP, is a national organization dedicated to training and educating U.S. citizens in responsible uses of firearms and air guns through gun safety training, marksmanship training, and competitions. Their vision is to lead the nation in marksmanship excellence, providing safe, high-quality, and innovative programs with a focus on youth. For more information about the CMP and upcoming events, visit thecmp.org.
Good morning, everyone. This is Ellen Tibbetts-Hurst, and I am with Rise and Shine with the Alabama Cares Program, and we're sitting down with Keith Parrott, the president of RMC. Thank you so much again for joining us today. And we've been talking about all things ER and everything, and so there's, like you said, there's just a lot of things that, you know, it's just not just one component of a hospital that you're having. I mean, as a president, that's a big, I wouldn't want to be in your shoes. That's a lot of work. So there's just a lot of components to this, and like I said, you know, we were talking about how RMC is not a for-profit, that kind of thing, and how you need to have, you know, relationships with everybody, the surrounding areas, because that is part of your mission as well.
Right.
So what other areas are you seeing improvements or needing improvements?
Sure. So you're right, it's complicated, and there are 1,000 different directions you could go. And one of the things that I noticed when I got there was a lot of busyness, a lot of activity, a lot of just kind of running around, but it wasn't organized and in alignment for the things that really matter. So one of the first things we had to do was sit down and say, okay, you know, what are the major strategies we need to pursue to improve things? And so we came up with 5 pillars to support that vision. So we want to be the trusted source for health and wellness in our region. That's great, but how are you going to do that? So let's see if I can remember the 5 pillars. You know, one is quality and safety. One is patient experience. Another is stakeholder engagement, so physicians, really employers, employees, everybody in the community. Community impact, which gets into the service we provide in and outside the hospital, and then our financial stewardship. And so we set a couple of high-level goals for each one of those. So take our quality scores. You know, there are websites you can go to, Medicare star ratings, rates every hospital in the country along quality and safety and patient experience. Leapfrog is another organization that grades hospitals from A to F on their quality and safety and patient experience. So we really dug down into the details of that and said, okay, what do we need to do? Our ratings for those are not where they need to be. You know, Leapfrog, we're a C. So we've got a passing grade, but we want to be A.
Higher.
That's right. So
strive for better.
So when you dig into that, when you look at the detailed statistics around mortality rates, readmission rates, so hospitals get in trouble if we take care of a patient, send them home, and they come back in 30 days.
Right, you don't want them to be.
No.
You want them to be return customers, but not in the way.
Not within 30 days. It's
not,
like
not with
what happened,
thing.
and sometimes, you know, that can't be controlled.
Right.
But you know, there's some national averages how you should do on that. Hospital-acquired infections, and so if you look at the reason we're a C, if you line up those quality scores, we're at or above national averages. So the quality is good. What's really dragging us down is the patient experience scores. So we've got a lot of work to do in that area. You know, you mentioned, you know, how many people fill out the survey. That's another focus right now. And if you're watching and you've been a patient, you've had a good experience, please take the time to fill out those surveys. And if you had a bad experience, we need to know that too, so we can improve. I've met with patients who have complaints, and family members and doctors, and almost every time at some point they apologize, say, I'm sorry, and my response is, do not apologize. I can't resolve a problem I don't know about. We need to know about that so we can fix it. Right.
And training is a big thing. I know even in my job, you know, so when something goes wrong, you can't train your staff in the right way that you need to train them if you don't know what the problem is.
Right. And so we need that feedback. So national averages for response rates for hospital satisfaction surveys is like 21, 22%. I mean, it's
pretty
not
low,
but we're like 7 or 8%. And so, you know, that's a big problem. So we're not getting enough feedback. The feedback we're getting is on the bad side,
right.
And so
it's kind of like one of those things that, you know, I remember my papa telling me when I was growing up, you know, don't complain about something you can do something about. So if you're complaining and you're not telling anyone, they can't correct they cannot correct a problem if they are not aware of it. So if you're not aware of something, you can't correct it.
And so when you talk about we have a low response rate, but the responses we're getting are bad, you dig into the details, and I'd say about half of our negative responses, at least, it's because of something that originated in the ER. You know, they had a bad experience, wait time or whatever in the ER. So you talk about there's so many things to improve. It's like, okay, that's the glaring thing that we've got to go after and go get. And that's why we've had a lot of focus on trying to improve that.
And I like what you said to our Exchange Club that day. You were talking about how you were putting the pressure on, like, say, for instance, the supervisors.
Yeah.
You know, and you were telling them, well, this needs to improve, and if it doesn't improve, then maybe they don't need to be a supervisor.
And that goes all the way to me. So accountability is a huge part of this. And so when the board hired me, I developed several goals for the year with measurable outcomes. And I told the board, I said, at the end of the year, it doesn't matter if you think I'm a nice guy and you really like working with me. This is really what matters. And if we're not making progress on this, you need to hold me accountable. And if I can't improve it, you need to go find somebody else who can. And so that accountability cascades through the organization. So my team, I told them, look, I like you guys. I want you to be successful, but if we can't improve these several metrics, I need to find somebody that does. And you know, earlier in my career, I struggled with those kind of conversations because you don't want to, you know,
you don't want to be the bad guy. Yeah.
But what you have to think about is the patients, the community. I mean, we need to care more about what their experience is and the person that I'm working with in the office every day.
And really, so, you're invested in the leadership by doing
well. And they want to be successful. And so my observation after 6 months is when I've given them things to do and said, do this, not or else, but if you're not achieving this, I understand why. We're making progress on that. So, so I'll come around and, you know, we're gonna, we. Like I say, I've met with people who've had good experiences and bad experiences, and I'm thankfully starting to get more people that have good experiences, so enjoy telling those stories.
And you know, I've also heard, and I don't know if this is true, I mean, I just have heard this from some of my clients, so correct me if I'm wrong, but they've had, in certain areas, they've had issues with ambulances taking them to RMC. Is that a problem, an issue that you're looking at?
You know, we have great ambulance services in Oxford and Anniston and Piedmont. I've met with Mayor Smith in Jacksonville and the fire chief there. They are our customers, and it's very important to me that we have an attitude of what do we need to do to earn their trust. And so actually, Tom Dixon invited me to come sit down, and I spent, I think it was nearly 2 hours on Good Friday afternoon with almost all of his paramedics and nurses. Just
and that's in Oxford.
In Oxford, yeah, yeah. Just you know, trying to understand what they're experiencing and how we can improve that. So, you know, absolutely, we want to have relationships where the EMS feels comfortable bringing them to us, and you know, we're going to earn that. It goes back to that, we're going to earn that respect and trust moving forward.
And you were talking about how your team members, you know, they live here and shop here and all that. So they're invested in our community too.
Yeah.
So they, you know, that's a good way to instill in them how important it is, but also to let, you know, the other, like you said, the other municipalities, you know, hey, you know, we're all a community here. We all need to work together. Well, and come as one.
We talked about that trust issue. I've said this over and over again in meetings at the hospital. Trust takes years to build up, and you can lose it in an instant.
Oh yes, I
and
agree
so
with
clearly
you.
With some of the reputational issues and the challenges over time, we've lost trust with a lot of people. And I can come on the show and make lots of commitments about how we're going to be better. until more and more people come and experience a change, it's going to take us a while to build that back up.
Right.
And
be a voice, like you
Yeah.
said, you know, for you guys out there, if you've not given a review, you might want to do that, whether it was good, bad, ugly, whatever, because
Yeah.
even though it was maybe prior to you coming there, you still
Yeah.
kind of need to know the history and
Yeah.
what people are thinking, what their vision of, you know, or their, you know, preconceived
Right.
vision is of
Right.
the hospital, because,
Right.
you know, like I said, I mean, I work with seniors, and, you know, I've heard good things. I've heard awesome things. You know, oh, yeah, RMC, you know, they saved my life. You know,
Yeah.
I've heard everything from that to I'll
Yeah.
never go there again.
Yeah.
So, you know, I mean, it's there and everything in between. But you guys are the voice, and you guys are the ones that need to let them know, because without you saying anything, you can't correct it.
Yeah.
You can't. I mean, it helps you to work on
Yeah.
it a lot better. I'm
Absolutely,
sure.
absolutely.
Yeah.
It's like any relationship. You need, you know, you can't give
Communication.
your partner the silent treatment.
yes,
if they're doing something that's
communication.
letting you down,
Communication.
you got to communicate that so you can know what you need to do better in your
And you
relationship.
said that you have a new vision for RMC too, and we talked a little bit about that. And I know that some people have said this, because I've heard this. Well, I don't want to go to RMC because they don't have the new technology, or they, you know, that kind of thing. So where do you
Yeah.
see RMC going with that?
That is a major priority for us. So my senior team, which has been doing a great job with us, we spent about 6.5 hours locked in a conference room last Thursday going through each of our top 8 service lines. Who are the physicians we need to, when I say who, you know, what physicians do we need to recruit? For instance, we have 4 super busy cardiologists. This community could easily support 6, so we need to go recruit 2 more. And then by service line, you know, what's the equipment we need? So cardiac cath labs are pretty good. We need a new nuclear medicine camera. You know, we have a very strong radiation therapy center that does great work. We have a great clinician there. Our linear accelerator is getting to the point where it needs to be replaced. So we just replaced our CT scanner. That was another issue that was causing some of the delays in our ER. The CT scanner would be down, and people were delayed in terms of getting care.
And I know you got a new chamber for wound care.
Yes, hyperbaric chamber, absolutely.
Because my friend Laura
Okay.
runs that.
Oh, good. Okay,
Laura.
yeah. And Dr. Magadia, and we have several physicians there that work with that. So we do have, frankly, a pretty long list of capital needs. But what we'll do is, you know, we're going to be identifying, you know, several $1 million worth of the priority needs, spreading that around through the hospital. And again, we're not in a financial situation to go get it all right now.
Oh, yeah.
But here's our
time.
plan to address the most pressing issues and move through that right now. So,
Gotcha.
yeah, that equipment first. I mean, I would love to spend a lot of money sprucing up the patient rooms and all of that. The aesthetics is important, but technology is
probably your number.
That's number
I would
priority.
say
Yeah.
that
Yeah.
is a priority over the flowers on the table
Yes,
in the window.
yeah. We'll get to
I
that
mean,
eventually.
Yeah. Just my personal
Right,
opinion.
right.
We are going to take a short break, everyone, again, and I'm sorry about that, but make sure that you watch the show. If you haven't watched it from the beginning, go back to YouTube, Fire Stick, Roku, Apple, all the things, and you can go back and watch it. But we're going to take a short break for a word from our sponsors. You're watching WEAC TV, Rise and Shine with the Alabama Cares program. We'll be right back.
On average, a tow truck operator is killed every 6 days in the United States. A tragic, yet preventable event. The fact is, most people don't know what it's like being a tow truck operator. The dangers that occur while servicing a roadside vehicle are real. However, you can make a difference to help lower this statistic and save lives by simply slowing down and moving over. This simple task can prevent an unnecessary death and allow workers to make it home to the families waiting for them. After all, it's the law in all 50 states for good reason. Do your part so they can live another day and be there for you when you need them. Move over. Their lives don't belong to you.
Backus Bibles and Books is dedicated to providing churches as well as individuals with products and services geared towards strengthening every relationship with Christ. We specialize in Bibles, Bible imprints, Bible restoration, church supplies, home decor, gifts, and apparel. Call us at 256-201-1202 or visit us Monday through Saturday, 10 a.m. to 6 p.m. at 1100 Highway Drive in Oxford, Alabama. We look forward to serving you, equipping the people of God to expand the kingdom of God.
I want to live. The leading cause of death of young Americans like me is gun violence, and oftentimes tied to substance misuse. NBA, NFL, NCAA, most of you look like me, and our communities need you now more than ever. Let's make I want to live more than just a hashtag. Let's make it a movement. I am a baller against bullets.
And we're back with the Rise and Shine program. I have Keith Parrott here, the president of RMC, and we're so very glad that you came today on this Friday. I know you're a busy man and you've got lots of things to do. And I don't know, I can try, guys. I mean, it is Friday, and so all my guests, I always tell them, I even got my director laughing in my ear, I always tell them it's Friday, so we have to do the Friday dance, and I always say, it's Friday, it's Friday. Hey, we even had a Master Sergeant dance for us, didn't we? I mean, that was awesome, Master Sergeant.
So
Bennett.
You didn't disclose that before I said yes.
No,
so, yeah,
I
okay.
can't give that away. I can't give all my secrets away, right?
I may not be doing any dancing on the show today.
We tried.
Yeah.
So we were talking about you growing services, specialty services included at RMC, and you were talking about recruiting more doctors in certain areas, like in the heart doctors and so forth, and I know that we were talking about orthopedics earlier. I think you want to grow orthopedics as well.
Yeah.
General surgery and all that.
Right, and one of the good things in orthopedics is we have a great number of really strong, again, kind of like OB, obstetrics and gynecology. I was really surprised by the number of high quality orthopedic surgeons that are here in the market right now. We have several to choose from. And this is an area where, again, we don't necessarily need more orthopedic surgeons. We have the component here to deliver that care, and we need to get the word out about the great care they deliver.
Right. Maybe just more technology or something.
Well, and we've got the latest and greatest robots to do your hip or knee replacement. I watched one of our surgeons do a couple of robotic knee replacements.
Oh, that's amazing.
It's amazing.
Yes,
I mean,
that's amazing.
I mean, not that anybody could do it,
right.
but when you see how they use technology to make it so precise and how quickly, I mean, I was amazed at how quickly our surgeons move through the cases, which is, you don't want to be under anesthesia forever. And so, so that situation where we've got the technology, when RMC has an older part and a newer part. The newer part is generally thought of as the women's center, but actually our orthopedic floors are in that new building. And so from the time you show up to get your pre-op time, your time in the OR, in the room, that's a serious service where there's not a lot of big things we need to add. We just need to tell people more about that.
Get the word out there,
growing surgery is important. One, because we want people to stay in the community to get care here. But two, hospitals get paid more for surgical things than they do for medical things.
Right.
And so in order to make that money to pay our staff more and get more equipment, we need more surgery. So back in December, January, February, we had dropped down to where we're only doing about 450 to 60 surgeries a month. We've now grown that up into the 600s. And so that's things like Dr. Crawford. How do we help Dr. Crawford do more cases at our hospital?
And he's on TLC. Is he still on TLC on his show? Is he
Probably. I mean, he's everywhere.
Yeah,
I mean, if you've been in his office, he's got a studio that's not much different than this. But he's got his hands in a lot of things. But so we're trying to, sit down with surgeons and say, how do we make it easier for you to work here? Cardiology is an area where, again, we have great cardiologists doing great work. They're all super busy. They need some help, so we're looking to recruit some.
And do you feel like, because I try to tell my folks this all the time, my little seniors, if you have a sniffle, if you're hurting, your blood pressure's high, or you don't feel like you're at stroke level or anything. I'm not saying that is an emergency,
Yeah.
but I'm saying, you know, just your normal run-of-the-mill, like your regular everyday
Right.
health issues. We always try to stress to our seniors that don't go to the ER.
Yeah.
You know, go to your doctor, go to your, because that frees, the ER needs to be emergency. That's why it's called the emergency room.
Right, right.
And you may not want to say that, but I'm going to say
No.
that because I feel like that lots of times, a lot of the wait time is because staff has to weed through all those people that, you know, are in there
Yeah.
and some not really necessary to be there.
Well, we have created a new dedicated area for less urgent care that's
Okay.
kind of next to the ER that helps offload some of that. You know, we got limited resources. The sickest people get treated first.
Exactly.
It doesn't matter, you know, and so to your point, to help yourself out and others, if you don't think it's, you know, a heart condition or a stroke or something that where you're going to be moved to the front of the line, go into urgent care or some other place. It's hard to get into primary care physician a lot of times. That's another area where we want to recruit a lot of new physicians is we need more primary care physicians.
You know,
And
doc in the box or something, yeah.
yeah, exactly.
Yeah.
But you know, those are things we're going to work on to try to help improve
There's
that.
a lot of components to it, you know. And you said that you want to make sure that transparency is your number one thing, and that RMC is not of the past. You're wanting to move forward, right?
Yeah, yeah.
So if you want to tell our audience, if you want to leave them with anything, what would be something that you want to?
Can I tell a story?
Yes, you can tell
This is a true story. The names have been redacted but this is a true story. I got a call from our board members about an individual who lives in Oxford whose loved one had probably needed a hip replacement. They had a fall urgent issue. And so I knew that the father who was the patient and the adult child was there. So I went to visit with that individual about the care her father was seeing. And she was very honest. She said, look, I didn't want to come to RMC because of the reputation. But we kind of didn't have a choice, and so we did. So they experienced the ER, experienced having surgery, and she just raved. I mean, she said, you know, I'm going to tell everybody that my experience was fantastic. And so what encourages...
experience proved her wrong.
It did,
Yeah.
it did. And so now, again, we're not perfect. I mean,
Right.
that same day, I'm sure there's people that we didn't have that perfect experience on. And what made me feel good was, you know, a lot of times it's like if staff know the president knows the patient, they're going to get special care. But by the time I got involved, they had already been through the program.
Right.
So we're getting more and more stories like that of people like, man, I didn't want to come here because of the reputation, but I did, and I had a great experience. And
Right.
so we want to build on that. Again, we've had days where that wait time, I mentioned we to get to a bed from the ER has been cut from 12 to 6. There are days where it's down to like 2 hours. There's some days where it's like 10 hours, and there are times we just get overrun and, you know, we
Right.
have issues there. But what I want the community to know is we have metrics and we have accountability, and we're not going to get it right every day, but we're going to get it right more and more often as we move forward.
It's a work in progress.
And as the community supports us,
Right.
again, that relationship, the more volume we have, the better we do financially, the more we can invest, so we can provide better care. And so,
Right.
you know, it is one of those things where as we get that, change that narrative and more people come, it will provide more resources for us to deliver better care.
Well, who can the public contact with their concerns, or where do they go to voice their opinion, or if they have questions? What would you, where would you steer them?
I should know that off the top of my head, but I don't.
Should they go to your website?
Yes,
or?
on the website, I believe there is you can do a Dear RMC CEO or Dear RMC President, but I get probably 2 or 3 emails a day from people. I think comes through the website, from employees and from people outside the organization.
Right.
But I try to respond to every one of those. You know, typically I very quickly say, got it, looking into it, and then we get the right people involved so we can give a response. But That should be on our website. If it's not, I'll make sure it's there by Monday morning.
Okay, yeah. So make sure you
Yeah.
go to the website. I'm
Yeah.
sure it's
Yeah.
RMC. Just Google RMC Regional
Right.
Medical Center,
Right.
Anniston. I'm sure you can find their website through there, and make sure that you voice all your opinions, good, bad, ugly, because everybody needs to know, and that's
Right.
with anything in life, guys. So, and what do you think is your biggest challenge? I mean, we talked about all these challenges
Yeah.
that you're facing. What is your biggest one, you think?
Trust.
The trust.
Yeah, I'm not worried about turning around the finances. Where we need to go with quality, I know how to do that. We've got the people to do that. You know, getting stronger financially makes things a whole lot easier. But I think before we can get there, is we got to regain trust. And so having conversations like this, trying to get the word out of the good work that we're doing, the improvements we're making.
And I
getting
have to
people
ask
to
this
trust us, yeah.
question too, because I know I asked this to you when you were at the Exchange Club, because I know that one of the challenges that a lot of hospitals is having, because like I said, I have friends, and my sister-in-law is a nurse too. I have friends that are nurses, and I know one of my friends who's a nurse, not at RMC, but at another hospital. She said that she left that hospital because she said that there were so many travel nurses coming in, making so much more money than she, and she had been there, I think, at this particular hospital, and it's not RMC, but it was a particular hospital. She had been there like 21 years, and some of the travel nurses were making more. Or just as much as she was, and so she wasn't moving anywhere. She said, I can't do this anymore. So I mean, I'm sure that's a challenge too. And I remember that you said that you were trying to retain your nurses that have been there so long, because those are the ones that your public gets to know. Hey, I hope I'm on the floor that Miss So-and-so was, because she was really good to me, you know, that kind of thing. So I'm sure that's a challenge as well.
It is. It is. That's that's a conundrum every hospital in the country is trying to figure out, because unfortunately there's enough people who want to do the travel nursing that it's hard for most hospitals to fully staff without using them. And so we went through a process before I got there where we dramatically reduced the amount of travel nurses. Well, we couldn't find the nurses to replace them, and so they were feeling short-staffed, and the ER was getting backed up because we couldn't open as many beds, and so we had to bring some of them back. And so that's kind of how we've been able to improve some of our metrics in the ER, is bringing some of that back. So I wish I had a solution for that. We're working through it.
But like you said, you know, it's a work in progress, right? So I mean, you're trying to have those conversations with the people that work there, and trying to win the trust back of everybody. So hopefully that will only get better as time goes on. Once you build that trust back into the communities, and people start coming back to RMC and seeing that, hey, this is a changed place, and maybe everything, you know, will just fall in line. I hope.
Well, it's going to take some time, but I'm confident we'll move in the right
And guys, you can't
direction.
expect this to happen overnight. I mean, nothing happens. I mean, it'd be nice if it did. But it's not. But I appreciate you so much for coming today, and I appreciate your time. And if you guys missed the show, the first part of the show, make sure that you go back. You can get the app on Apple, Roku, Fire Stick, all YouTube. Go back and watch it. And you can also go to WEAC TV 24 on Facebook and watch it as well. Your local Sparklight, I think is what it's called, local cable. You can go to that too. And I also want to remind you guys about our event coming up this coming Tuesday, which is just coming up this Tuesday. We are actually our community health series that we have for our 10-county area. We have this every month at the Oxford Civic Center. We are having it on the 22nd, which is this Tuesday. It is Kids Day. It's Kids Day, Grandparents and Parents Day. We're going to have have bouncy houses. Everything is free except for the Kona truck, the Kona ice truck. You have to pay for your Kona ice. But we will have people there. We have vendors that are set up. We have door prizes, and we have some great speakers. Well, Oxford PD will be there talking about family safety. We have the Anniston Museum and Gardens are going to be there, and they're going to bring some of their animal ambassadors too. I can't give away who they'll be bringing, but they're going to be bringing them, and they'll be talking about all their great programs for school-age children, for families, last week we just had a show with the ladies from the museum, and here at TV24 they just gave us such good information. We're all going to visit very soon, so make sure that you come to that, and we have it every month, and don't miss it. And we are so glad that you joined us today, and thank you again for coming. We hope you all have a wonderful weekend. Stay safe and mostly stay cool. And we'll see you next week right here on WEAC TV 24 Rise and Shine with the Alabama Cares program. Have a wonderful weekend, everyone.